Before we introduced a lead nurse for deteriorating patient and sepsis, we looked at our quality account for 16-17, which identified that we needed to do something differently.
We know that sepsis kills 44,000 people within the UK each year, and the unwarranted variation that we found was that in September 2017 there was only a 17% compliance with the sepsis screening tool. We put a quality improvement project together which incorporated a multidisciplinary team approach to sepsis so that we were all coming at it from the same angle. We introduced a nurse integration leadership programme where nurses are feeling empowered to be able to escalate patients that may have sepsis. We rolled out the sepsis training to all of the people regardless of their role, because receptionists have a role to play, porters have a role to play, registered nurses do.
We introduced physios and occupational therapists into our multidisciplinary approach along with our doctors. Our physios are really key in that aspect, and they themselves have identified a patient who's deteriorated with sepsis.
We had attended the training, and the next day myself and one of my colleagues were going to see a patient, and they just didn't seem right. So we checked all of the observations and things, and their use score was quite high. So then we felt confident enough to say to the nurses and to the doctors, this patient has suddenly deteriorated, we think it might be sepsis.
Infected cut on the hand, do you think that's quite common?
I think we all think we know about deteriorating patients and the signs of sepsis, but it was a real eye-opener and the impact it has on patients' lives. For me personally, the escalation process was really, really important, and which doctors to escalate to ensure that patients got the quickest medical treatment and the right medical treatment. My role as a sepsis champion is really important. It allows a link between the sepsis lead nurse and the ward. I help educate the staff on the ward, teach them how to use the proformas correctly, help identify and support them in treating patients that have been identified as having sepsis.
Can the sepsis team come to resus, please?
If a patient comes in by ambulance, the paramedics will hand over that a patient has maybe several red flags. They're querying whether the patient might have sepsis or not. And then what we then tend to do is make sure that we screen that patient for sepsis.
The observations we do using the early warning scoring system will indicate a score, and if that score is 5 or more, or 3 in one parameter, we then know that this could be sepsis, and we activate the sepsis screening tool. This is a really easy to use piece of paper and it identifies red flags. When it's activated that this could be sepsis, the sepsis 6 is on the back of the tool and it tells us what we need to do, and it's basically 6 interventions that need to occur in the first hour to achieve the best possible outcome for the patient. I think the best outcome that we're really proud to have achieved is the completion of our sepsis screening tool. In the last 8 months, we've measured that we've improved from 17% compliance to 96%.
Michael, he had been unwell for a number of months with various health conditions. So when Michael presented to the emergency department, he was screened for sepsis within the first 15 minutes of arriving. He had a set of observations completed. Those observations revealed a national early warning score of 6, which means that Michael clearly had some elements of organ dysfunction.
Christmas 2017, I myself was ill over New Year with the flu. Since then, I wasn't feeling right. Never really paid it much attention.
When somebody presents to the emergency department, they've got multiple comorbidities or they've got a complex past medical history like Michael had. What tends to happen is those patients can sometimes be missed because sepsis has a lot of symptoms that can be related to other conditions. The outcomes have been really powerful, so we're above 90% for our ED screening. We are currently at 89% for our IV antibiotics within 1 hour in the emergency department, and we've managed to get our sepsis screening and treatment for inpatients to 100% for the last 5 months.
In leading change and adding value, I really feel that we've demonstrated commitment 8 within the department.